just to clarify, my talk was on novel metabolic imaging approaches. Yeah. So over the last 10 or 15 years, there's been a few imaging technologies that's been coming into the pipeline. And one of the challenges we have, so I'm an oncologist and I've got research interest in developing imaging biomarkers in cancer. So one of the challenges we have is how does imaging keep up with just this very novel, very innovative therapies that we have in oncology? Because one of the things we find is that you might find disease response or disease progression on maybe liquid biopsies or some other new technologies, but imaging might be lagging behind in terms of identifying changes in disease status over time. So I talked about some few novel imaging technologies that is coming into the pipeline. Hopefully some of them will be in the clinic over the next 5 to 10 years. And I also talked about the challenges that some of them might face before they can actually get adopted in the clinical practice. So that's the overview of my talk. I can go into more detail if you want me to. There are a few ones that I mentioned in my talk. So one is called hyperpolarized MRI. So normally when we look at MRI, is the way the protons are aligned, the water protons are, or hydrogen protons are aligned in tissue, in water. And the difference between the ones that align up or align down, that's how we get a contrast. But there's so very few of them that align against each other. So what we do with hyperpolarized MRI is that we increase the polarization, if you like, so that we have an increased number of protons aligning against and increased aligning for. And if you have that kind of difference, you have a huge amount of contrast from the images, which will give you some insight into the biochemical processes within the tissue, gives you insight about the microscopic changes within the tumor, which in a way we have not been able to do before up until recently. So that's a very interesting technology. But only about 30 centers in the world, or less than 30 centers in the world, have access to that technology at the research level. And it's going to be quite expensive. It takes time to do. It takes a lot of resources. And it needs to be more portable for use in clinical practice. So it's a very promising technology, but we're still far a few years away from clinical adoption. The other one, which I think is already used in clinic in different settings, is what we call fat water imaging. So if you look at bone marrow, look at lymph nodes or soft tissue, wherever you turn within the tumor, within the tissue, you have some elements of fat within it. So bone has some fat quantity within it, lymph node has some fat in the middle of it. So there's this very clever way of imaging changes in fat quantity within tissue. And you can actually use that changes to see how much tumor has disappeared, how much fat has displaced the tumor with or without treatment. And that is quite interesting because they've now been using that for screening patients with familial genetic conditions like P53 mutations, lymphomania syndrome. And also we use that in assessing disease response in breast cancer, whole body MRI, in prostate cancer, as well as in myeloma, multiple myeloma. So it's quite interesting. And I talked about some other ones like using MRI fingerprinting, also thinking about now combining different types of data, so imaging, genomics, and clinical data, and using that multimodal kind of approach to find deeper insight into interrogate tumors much more deeply, and also predict their response to treatment, or predict or prognosticate patients going on various types of therapy. So it's quite an exciting field, an exciting time to be in imaging, and how we can complement whatever is happening in therapeutics with imaging approaches over time.